if you're insured through United Healthcare, a deadline is looming and you could soon be paying for your health care out of pocket. United Healthcare is currently working with several providers to reach an agreement to continue in network coverage. Alejandra Hernandez spoke to one person impacted by these changes.
That's what I do for my hobby.
Carl Jones took up woodworking to pass the time after his doctor told him to take it easy on his heart. And for years, United Healthcare Insurance helped pay for those doctor's bills.
I never had any trouble with them. They was always good to me.
But that all changed last year as a dispute between United Healthcare and several healthcare providers, including St. Bernard's, is putting those insured with United Healthcare at risk of paying their doctors out of pocket.
I was stressed out about it because, my specialties are a heart doctor, a lung doctor, a bladder doctor, all of them associated with St. Bernard's.
A statement from a United Healthcare spokesperson says, quote, "We remain committed to good faith discussions with St. Bernard's and are hopeful that we can work together to reach an agreement that is affordable for families and employers in Arkansas," end quote. Meanwhile, a statement from St. Bernard's says in part, quote, "It is highly unlikely that St. Bernard's and our affiliated providers will be in network with United Healthcare after our current agreements expire," end quote. According to St. Bernard's, their issues with United Healthcare stem from how the company conducts business and writes its clinical policies. Over 300 physicians at St. Bernard's will move out of network once the agreement expires on March 1st. And St. Bernard's Medical Center itself will move out of network on May 1st. Jones said that he simply can't afford to pay a primary care physician, let alone a specialist, out of his pocket.
And that's not including the cost after, going through that specialist. I can't afford that.
Jones says others may be facing a similar fate.
Friends of mine that are on United Healthcare. His wife is bedridden. So, it's got to be stressing him out.
With the clock ticking, Jones said he wasn't left with many options.
I had no choice but to switch. I can't go without insurance. I got too many health problems as it is.
Jones is now back to working in his shop with one less thing to stress about. And he says others shouldn't wait until it's too late. In Jonesboro, Alejandra Hernandez, KATE News.
Thank you, Alejandra. And again, United Healthcare is working with several providers to reach an agreement to continue in network coverage. On your screen is the providers that the company is currently talking to. Some of them will be out of network in the next few months. You will be able to find more details over on KAIT8.com.